about nursing, debunk popular misconceptions. Probably hear about a lot of things that people think that we do, but in reality, they don't know what we really do. Myth 1. Nurses just give medication. You probably hear that saying. It's like they don't do anything. They just give medication all day. Nope, we're responsible for more than just handing out pills. We perform assessments, monitor patient conditions, communicate with healthcare team, emotional support, educate patients, coordinate care, and just a whole lot of shebang. Top responsibilities of a registered nurse, as you can see on the left, you can read through it, or I can glance over it real quick. Assessing, observing, preparing patients, talking to families, dealing with a lot of issues that's happening around, monitoring, drawing blood, education, patients, supervising, it's just a lot of things. So no, we don't just give medications. Real picture, critical decision making. Yes, nurses are quick to make decisions because say like you got a med-surg floor 5-1, you got to think about all your 5 patients. If you're in a different ratio of 8-1, all those 8 patients. If you're in ICU 2-1, 4-1, whichever it is, whatever state, you got to think about what's happening with each patient at each time. If you're in one room, you got to think about the next patient. If it's a rapid response, a code blue, so many different things. Patient advocacy. Nurses act as a voice for patients, ensuring their needs and concerns are heard for the healthcare team. So there's a lot they need to do. They're there assigned to a patient, but they're also protecting them from anything that's going to happen, from like case management, discharging them early, doctors giving them the wrong medication without double checking, pharmacy messing up on the medication order. There's just a lot of things you got to pay attention to, and coordinating care of like all aspects of the patient's care team, like I just said, managing medications, collaborating with doctors, etc. Myth 2. Nursing is just an easy job. Is it? It could be, maybe to a certain extent at a patient clinic or maybe a small unit, but it's not an easy job overall because it's physically, emotionally, and mentally demanding profession because you're dealing with a lot and going through a lot all once you step into your work shift. You're running. So it can be a long shift. It can be life and death. You have a patient that dies. 10 minutes later, you're bagging them up. They're out the door. You get a new admission. Your charge nurse is there knocking on your door. So, yeah, it's not easy. And nursing is demanding. So as you can see from all these pictures, you deal with all this in a world of chaos, and you sometimes go home and go, what the heck just happened? You're working in the ER, busy emergency room, you're dealing with so many things happening at once, people screaming, crying, yelling, multiple patients. If you're on the floors, you're dealing with a lot of different patients' personalities, diagnoses, families, personalities of so many sorts. So providing care during emergencies. So if something happens, you got to drop everything and just go right to your emergency. You can't focus on anything else, and that's where you have to really be focused and manage everything at the same time. That's why time management is very important. Navigating complex workflows. They work in so many different ways, ranging from different professionals. You're working with a therapist, you're working with speech therapists, you're working with doctors, you're working with the families, you're working with hospice agencies, you're working with surgeons, you're just working with every aspect of care of the team just to help that patient. And addressing emotional needs is probably the main thing that you have to do, is just stepping back from all the chaos and just listening to your patient just for a couple minutes. That patient care experience is very, very important if you should just listen to them. That's all it takes. Myth 3. Nurses work 9 to 5. A certain extent, if you're working in the clinic, maybe you're in and out 9 to 5, Monday to Friday, no weekends, no holidays. But typically there's 12-hour shifts, 10-hour shifts, 8-hour shifts. And sometimes you're not really going home early because you still got a chart. You got to take care of your patients. Some code blue happens. You're waiting for the next nurse to come down to give a report to. There's a lot of things that it doesn't get you out in time. So it's not just you get in, you just leave your stuff and walk away. You're working nights, you're working on the weekends, you're working holidays, 24/7 coverage. It's going to be 24/7 depending on your schedule. But sometimes there is a lot of overtime if you're looking for that too. Then pluck the irregular hours. This can be hard on a lot of people. I've seen people work a lot of 16s in a row and it does not look good. People can pass out, get tired, dehydrated, take a toll on their body, stress, sleep patterns. It's not efficient at times, and that takes a toll on the nurses for the patient care after. Myth 4. Nursing school is easy if you're good at science. Yeah, that's not true, because you can be good at science, you can be good at math, you can be good at cooking, art. It just depends what kind of person you are. But in reality, nursing school is about test taking strategy. But it does come down to a point where you have to critical think about all the situations, diagnoses, and what's going on with the patient. You got to manage your stress. You got to be really calm and collective during this stressful time. So a lot of teachers put pressure on you, but then in reality, when you're working, there's a lot of pressure going on, but you have to just remain calm. Real life clinical experience is dealing with patients is the main thing. Dealing with human bodies who have interactions, personalities, emotions, and going through tough times, and you're there to support them. Communication is very important because whatever you're going to let them know, tell them, is going to be the give or take on how they're going to feel throughout your shift. And then empathy, you just got to take some time and listen to them. That's all it's going to take. Just stepping back, talking to them, it makes a very, very big difference. And the challenges of nursing school, juggling your coursework, there's just so many things thrown at you, from tests, quizzes, and everything. Clinical hours in between that, and your family lifestyle, and working through all that too. Emotional challenges. People are going to be stressed because everybody wants to pass, everyone wants to succeed, and time management. When you have so many things going on, this is where you're going to really learn your time management skills, because when school's done, reality comes in. If your time management skills is not good, you're going to struggle and juggle a lot of things, but over a course of time, it gets better if you focus on it. And adapting to new environments, because you're going to be changing classrooms, units, meeting new people, clinical rotations, and teamwork and communication is collaborating with other schoolmates and everybody else in general. Myth 5. You need to be born nurse to succeed. Actually, that's not true. Anybody can be a nurse. Anybody that wants to put their mind to it, get to it, apply to school, take the courses, they can do it. Look at you becoming an awesome nurse and shit. And that is true. All you have to do is just get through it, and that's it. It's a lot of work, but it pays off in the end. And cultivating empathy and professionalism. Listening with attention, empathetic body language, emotional intelligence training, compassion, and adapting to diverse needs. You just have to be a well-rounded person with empathy and just cool, calm, collective, just to help make your life easier and make the job easier. So is nursing school really that hard? Yes and no. It all depends. You might have some easy days, some hard semesters, quarters, but it all depends on your study habits, your time management, and your skills, and collaborating and asking questions. Tips for success in nursing school is staying organized. So this is where time management and organization means a lot. Not being distracted by so many things outside of school, building a support system, meeting friends right away, and having study groups, and prioritizing self-care. Always take care of yourselves on your days off when you have downtime, because you have to take care of yourself to focus and get better. And ask for help when needed. Asking questions is optimal, because that's going to get through everything in life, from school and from and the reality of work too. Always ask questions. And that's all.